The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar topic today is Taking Charge, Caring for Your Mind and Body. My name is Ambreen Mann, Program Manager here at the ABTA, and I'm delighted to introduce our speakers. Dr. Roy Strowd is a neuro-oncologist at the Comprehensive Cancer Center at Wake Forest Baptist Health. He treats patients with gliomas and other primary brain tumors and is an active clinical researcher. His research work includes clinical trials that are discovering new treatments for glioma, developing imaging studies to assess how these treatments work, and identifying ways to improve the quality of life for brain tumor patients. Also joining us today is L.J. Amaral, a registered dietitian who is board certified in oncology nutrition. She works at Cedars Sinai as a clinical research dietitian and is researching the efficacy of the ketogenic diet as an adjunct to standard of care therapy for CNS malignancies. She specializes in cancer nutrition, therapeutic ketogenic diets, and oncology nutrition research. She also hosts Nourishing Nutrition Kitchen weekly on social media, where she makes easy cancer-fighting recipes. Thank you both so much for joining us. You may now begin your presentation.
Well, great. Thanks. Thanks so much, Ambreen. It is my pleasure to welcome you. My name is Roy Strowd. I woke up with a normal voice this morning, and it has rapidly gone away over the course of the day today. So I apologize for the scratchiness of my voice. I'm so excited to be here with LJ, and now even more grateful that she will help us to walk through this presentation and save a little bit of my voice as we go through. So Ambreen, we'll go to the next slide. And LJ, I'll turn it over to you for disclosures first.
Thanks so much. I'm really excited to be here. My name is LJ Amaral. My disclosures are that I am a scientific advisor for functional formularies, Ketokind, and I'm also a consultant for a company called Ketana.
And from my side, again, I'm a neuro-oncologist and work with a number of companies that do neuro-oncology work, but no companies that are specifically involved in what we'll discuss today. Next slide. So to start things off, LJ and I wanted to really take a step back and talk to you about how a neuro-oncologist thinks about brain tumors and brain tumor care in general, and which patient types the information that we'll talk today is most relevant to. So in neuro-oncology, there are a lot of things that can go and travel to the brain. We see brain tumors in many patients. And in general, we divide those into two buckets. So they're the primary brain tumors, and much of what we talk about today will be related to patients with primary brain tumors and those primary brain tumors. But we also see brain metastases, and actually this is the most common type of brain tumor, and that's a tumor that's spread to the brain from the lungs or the breast or the skin, a melanoma, or the kidneys. And that makes up about 50% of the tumors that we see on the brain. Today, we're going to talk mostly about data and experience and consensus related to the primary brain tumors and primary brain tumor patients. And when we think about primary brain tumors, the four most common are listed here, and three of those are benign brain tumors. That's meningioma, pituitary tumors, and vestibular schwannomas. And we think about completely different care and treatment and side effects with those tumors than from gliomas. And the vast majority of what we'll talk about today will be related to patients with gliomas, and that's the most common primary brain cancer that we see. Next slide. So again, when I'm seeing a patient in the clinic, one of the first questions that I ask is, where is this tumor? Is this a tumor in the brain, or is this a tumor around the brain? And I want to spend just a couple of minutes giving you all an idea of what's going through the head, the mind of the neuro-oncologist when they're first seeing you. The first type of brain tumor that we see is a tumor that forms within the brain, and you can see that in the MRI scans at the lower left side of the slide. We're looking at three different types of brain tumors that have started, developed, and will remain within the brain. The MRI scan all the way to the left shows a white area that's in an area of the brain that we call the temporal lobe, and this is a low-grade glioma. It's white, it's been there for a while, there's not a lot of pressure on the brain, and that's likely a tumor that first presented with seizures. It looks very different from the very aggressive tumor that you see in the bottom MRI, the MRI scan that's on the left side of the slide at the very bottom. It's white with dark areas on the inside, and there's a lot of pressure around that tumor. And we will treat these differently and manage them differently, and we may think about diet, lifestyle, and exercise differently for those patients. Tumors that are formed within the brain come from the cells that are in the brain. And when we think about the brain, there's really 5 things that make up our brain. There are neurons, oligodendrocytes, astrocytes, ependymal cells, and these primitive cells we call neuroectodermal or neuroepithelial cells. And you can see those listed on the right side in the cartoon. The most common cell type in the brain is the astrocyte. It's the support cell. There's actually 3 astrocytes, 3 support cells for every neuron. And so that's also the most common brain tumor that we see, an astrocytoma, which is the most common glioma, and that's where glioblastoma comes from. And when we're thinking about diet and lifestyle, exercise, mind-body interventions for the brain, we can think about them for the tumor and treating the tumor, but also supporting all of those other structures, the neurons and the other normal structures within the brain. And you'll hear that as we go through this talk. Next slide. The other big category of brain tumor that we see are tumors that are not within the brain, but form around the brain and the structures that surround the brain, the spinal fluid, or in the saran wrap that covers the brain called the meninges. And you can see a few examples in the MRI scans here. The top right MRI scan is showing an optic pathway glioma. That's the white line that's going from the brain to the eyeball. And Ambreen, thank you for outlining that. So that's an example of an optic pathway glioma. In the MRI scan to the left, we see tumors around the outside of the brain. There are tumors that are going to the ears, and those are the 2 white tumors. Ambreen has circled that nicely there. Those are vestibular schwannomas, and in the back of the brain is a meningioma. And so these tumors that form around the brain are often the more benign tumors. They're unlikely to be cancers, and we treat them and think about them differently when we're consulting and evaluating patients. Next slide. And so lastly, I want to open our conversation with the goals of treatment. And when I'm sitting down with a patient, we're really thinking about 3 things. 1 is how do we treat the tumor? 2 is how can we minimize side effects? And 3 is how can we advance or enhance quality of life and function for the patient? And diet, exercise, lifestyle, mind-body interventions, we'll think about those differently based on our goal for treatment. When we're thinking about treating the tumor, the most common first step is surgery, and that allows us to diagnose what this tumor is and start the treatment with maximum safe surgery to remove the tumor. There are other treatments that we think about for tumors. Laser therapy is a minimally invasive approach, where through a small burr hole, a small hole in the skull, we're able to insert a laser and minimally treat or maximally treat the tumor with a minimal intervention. Radiation and chemotherapy are typical treatments for brain cancers, and increasingly, targeted therapy, targeting a specific gene that's mutated in a cancer, or immunotherapy, learning how to harness the immune system to treat cancers, are the ways that we treat tumor. And diet in particular and some other interventions are things that we hope in the future could treat tumors, but we don't yet have a lot of data to support the use of those treatments for this goal of treatment. The second thing we think about with patients are minimizing side effects. And there are a number of side effects that we can see in a patient who has a brain tumor or is going through treatment. And you may have experienced some of these. Some of our tools to help minimize side effects and improve how our treatments do are to adjust the dose, minimize the dose, and we avoid that if we can. But if we need to, we adjust the dose to improve the tolerability of the treatment. For patients having nausea, we think about anti-nausea pills. Corticosteroids are used commonly to minimize side effects and help improve brain swelling. Bowel regimens may be needed, and adjusting diet or dietary interventions can be very effective for minimizing the side effects for treatment. And we'll talk a little bit more about that as we go through the talk. Our last goal is to enhance quality of life. And this is really where mind and body therapy can be extremely important. We think about enhancing sleep, improving activity and exercise. We want our patients to be driving as long as that is safe. It's important for independence. And we think about job and value. What are the goals that our patients have in their life, and how can we support those? And this may be a particularly important area where diet, exercise, and lifestyle interventions can be important for our patients. So next slide. So I'll end this first part with thinking about sort of the clinician's overview in diet, exercise, and lifestyle. Well, what are these treatments? Well, they're the things we do every single day. What do? We eat, we sleep, and we move. And those are important things that make us who we are, that help us support our happiness and our well-being. And what we'll talk about over the rest of the talk today is how we can incorporate those fundamental aspects of who we are as a human into the treatment for a brain tumor. And hopefully at the end of this talk, you're encouraged to go back to your neuro-oncologist and ask about diet, exercise, lifestyle, and other interventions, and think about how they could be incorporated into your care. And I'd like for you to think about whether what you're looking for is something that will enhance your treatment to reduce side effects or promote your quality of life. And having that discussion with your neuro-oncologist can help to incorporate some of the principles that we discussed today into your care. So with that, LJ, I'll turn it over to you to dive into some of the data on this.
Awesome. Thank you so much for that super comprehensive overview so far. I definitely learned something. And so let's really drive it home and talk about the fact that there is a bidirectional street, so to speak, between the gut and the brain. And so we do have a nerve, the vagal nerve, that innervates from our brains to our gut and can create changes in a lot of different things that can affect the way that we eat or what we want to eat or even how we feel. And so really the old age clause that we are what we eat actually does have some weight, and it does have value because our brains can influence our gut microbiomes, which can also then influence our neurotransmitters and really change our behaviors and the way that we feel. And so what I really want to focus on is that your appetite, your diet, your nutrition, your exercise, it can have a positive or maybe a negative effect on your appetite and energy balance, your emotions and your attitude, your response to stress, your learning and memory, and even sometimes your responses to pain can be modulated through trying to better your mental health through your diet and exercise or physical health. Next slide, please. So in general, this is kind of like a blanket statement that I would tell anyone, but rather if you are looking for more personalized information, just like Dr. Strowd said, I would really encourage you to go back to your team and see if there's someone that can work with you that takes into account a little bit more of the bigger picture, which is who you are, because we don't really work in silos, so to speak. But so in general, what I tell my patients who are having brain tumors or are going through treatment for brain tumors and cancer in general is to really avoid and limit processed foods. So processed foods meaning things that are packaged or ultra packaged because they have a lot of different additives and chemicals to create the shelf stabilization that can also have an effect on our bodies and the way that we metabolize our food. We want to choose more high fiber foods, which are going to be plants mainly. So I recommend a really nice variety of vegetables, fruits, nuts, seeds, those kinds of plants that are really helpful in terms of especially aiding with any bowel regimens or bowel health to help evacuate on a daily basis. But also high fiber foods have a number of different positive effects, such as lowering your cholesterol, or even if you are maybe premenopausal, it can help with your estrogen or your hormone regulation. And it's something that can really feed your brain, so to speak. Similarly to the processed foods, we want to avoid or limit the number of added sugars and sugar sweetened beverages. So for instance, if you are having a yogurt and it has fruit on the bottom of the cup, there's going to be added sugars that are in that yogurt versus just the normal milk sugar. And so that's something to bear in mind. And we want to try to limit the amount that we're having throughout the day. And then sugar sweetened beverages, meaning things like sodas and even juices that have added sugar in them. We do want to, again, limit the amount of sugar that we're eating. It's not healthy for anyone, and it can create a lot of chronic inflammation over time and lead to weight gain, which is a whole different ball game. We want to choose lean proteins, so things that are less fatty if possible. So things like poultry or fish especially, and we want to emphasize those omega-3 fatty acid fish. So things like sardines, mackerel, anchovies, salmon, herring, even tuna would be a good option. And we can go over more sustainable options in a little bit. Even plant-based proteins, I think, are also totally fine to include. So things like tofu or edamame or quinoa, another plant-based source of proteins too, more fiber, which we like. And in general, we want to enjoy a variety of plants, herbs, and spices because they all have amazing anti-cancer properties that can help in a number of different ways to enhance your health and make you feel better, especially as you go through treatment. So in general, if we want to take a big umbrella term and make it very small, we want to think of whole foods as your diet principles, so to speak. Next slide, please. And so really, let's focus on some of the superfoods for the brain, so to speak. And so I have pictured here walnuts, and I love to highlight them because they literally look like little brains. And so we want to highlight them. They have a lot of omega-3 fatty acids, which we talked about on the last slide. And studies have shown that if you eat and enjoy lots of omega-3 fatty acid rich foods or mono and polyunsaturated fats, it can actually help to decrease your cognitive decline, and then also help to decrease the pro-inflammatory pathways and therefore increase the anti-inflammatory pathways and maybe reduce the amount of cerebral edema or brain swelling that you might have. Berries in general are great. Blueberries are wonderful. I just highlighted them for fun. And they have a lot of anthocyanins and polyphenols, and that has been helped to enhance your cognitive function. We have MCT oil here, or medium chain triglyceride oil, which is very abundant on a ketogenic diet. And that can be used as an alternative fuel source for your neurons and brain cells in general, which can give you a little boost of energy as well. We really want to emphasize vitamin D rich foods if you can eat them or incorporate them into your daily life. And if not, then maybe we consider a supplement, especially if you are deficient. Studies have shown that those who have vitamin D deficiencies actually have a higher incidence for dementia and cognitive decline. So it is really important that you have adequate levels of vitamin D in your blood and in your foods or in your supplement. Green tea I highlighted, or tea in general. I do want to note that if you are on radiation, it's important to not exceed, I'd say maybe like 2 cups of green tea per day, just because it is a very potent antioxidant and that works against your radiation treatment. So we do want to be cautious with that. But other than that, you can have tea in general, which will still give you L-theanine. Green tea has the EGCG, which is a very potent antioxidant, like I said, and L-theanine can help to improve your cognitive performance as well. Egg yolks, I know this is kind of like a controversial topic because when I was in nutrition school, we were just learning that egg yolks are maybe not so terrible. And we've confirmed that they're actually not terrible at all. And I would encourage you all to enjoy them as you'd like, because they have a lot of choline, which is helpful for a precursor in your brain for a neurotransmitter called acetylcholine. I've highlighted avocado, pepitas, or pumpkin seeds, and dark chocolate. These are a really great source of magnesium, which has been shown to help with migraine prevention and help improve memory and learning. And then I've also highlighted red and orange plants. So any kind of red or orange fruit or vegetable will give you the carotenoids and vitamin A that are going to help in terms of your neuroplasticity and your healthy survival of your neurons. And then also the last thing that I've highlighted is Brazil nuts in general, because they have a plethora of selenium, which is an important mineral to help your body create an endogenous antioxidant called glutathione. And so that will help protect your normal cells and minimize damage to other cells. Next slide, please. So again, just to really drive it home, we love color, we love variety. These are great fruits and vegetables to be focusing on as you wish, and also a great example of very high fiber foods and plants that you should definitely try to enjoy as much as you can throughout the week. In terms of fish, I just want to talk briefly about the mercury levels because this does come up quite frequently in my practice. And so the best choices are listed on the left-hand side. And so those are the ones that have the least amount of mercury. You're very safe to be including these in your diet. And then in terms of the choices to avoid, though, these are the ones you really want to limit as much as you can. Again, just due to the excessive mercury content that has been seen in these types of fish. So another great question that I get frequently in one of my areas of research is ketogenic diets for brain tumors, because there's a lot of information out there for brain tumors and the ketogenic diet. And so what is the ketogenic diet? It is considered a very high fat, moderate protein, and a very low carbohydrate diet that completely avoids sugar. And in the table that you see here, you can see that there are actually multiple different ways that you can achieve ketosis through these different types of ketogenic diets. So these ratios that you see, 4-to-1, 3-to-1, 2-to-1, or 1-to-1, are really looking at the grams of fat versus the grams of protein and carbohydrates combined. And so for a 3-to-1 or classic ketogenic diet, we're looking at usually about 80 to 85% fat for those patients. So the majority of your calories are really coming from fats, and then you're having a very moderate amount of protein and very little amounts of carbohydrates. And that's really to ensure that your body changes into this metabolic state from using glucose or sugar as fuel and changes over to ketones or fat as fuel. And so I note that there is some, but not enough evidence to support the use of a keto diet for brain tumors on its own. And we'll go over some research, though, that does support the use of keto and my experience with using it in my own practice. And something that I consider when somebody comes to me and says that they're interested in starting this diet, I really take into account multiple different factors to make sure that patients are really successful. And I do want to just point out that it's not for everyone. I've had a lot of people go through this diet and there's a lot of variation. And so I will say when it works, and sometimes it doesn't fit for you, and that's totally fine. So the types of fats do matter, especially when we're on keto, but in general as well. And so like we've talked about throughout the last few slides, we really want to focus on those omega-3 fatty acids, or the mono and polyunsaturated fats, while on keto, more specifically, of course, in general, but definitely on keto. In my experience, I've been seeing a lot of things, especially from word of mouth or social media, about things like dirty keto or lazy keto. And I'm not necessarily sure that, choosing super high processed foods or a lot of saturated fats are going to give you the same benefit, even if you're in ketosis, versus a really well-planned keto diet that emphasizes good fibers and these types of healthy fats that are listed on this slide. So then really to drive it home for keto, the foods that we avoid, it is a very restricted diet. And so I do want people to take that into account. Food is a very social aspect of our culture. And so if it's something that, would not enhance your quality of life, it would decrease your quality of life by missing all of these types of foods, that's something to really consider. So just to talk a little bit about the research that is out there for keto and cancer in particular, I like to highlight this research article that was published in 2019. And this study is a literature review. And so it looks at all of the different types of studies that are available in terms of keto and cancer. And they did this nice review so that we didn't have to. And so we looked at preclinical and clinical studies, and these are pie charts that are looking at what types of cancer have been shown to use the ketogenic diet so far. And we'll go over what's the difference between preclinical and clinical studies. And then in the middle, the studies that they have looked at, they're shown 60% of studies have shown that keto may have this anti-tumor effect, especially for brain tumors. And then there's a lot of kind of unclear evidence. We're still in the very native stages, I think, in terms of showing this efficacy with humans. Next slide, please. So preclinical studies are in vitro, in vivo, and animal-based models. And that's basically the foundation that we all need in order to move on to human studies to make sure that it's safe to be doing this. And so what this literature review had said was that within the preclinical studies, the evidence is very strong for using the diet with brain tumors. And so it's shown that it could potentially enhance targeted therapy, like Dr. Strowd had mentioned. We have that it could be influenced by different cancer subtypes or genetic backgrounds that still needs to be explored. There's very little evidence on the ketogenic diet and metastases. And then something to note though, there were no adverse effects observed in these preclinical studies. And though I'm not sure how the mice would complain, but we'll go to the next slide and see what the human studies said. So clinical studies are done in humans, and it can range from a very small number of patients to a very large number of patients. And so what this review article found a few years ago were that most studies that were published within cancer in humans were actually quite small, and they were really looking at pilot and feasibility studies, meaning, is this something that can be done? And so there are very few randomized controlled trials, which is considered the gold standard for research. However, all of these clinical trials that have been reported and published are all consistent with showing that the ketogenic diet can reduce your blood glucose or blood sugars. You can get into the metabolic state of ketosis. It's feasible, you can tolerate it. And this has definitely been my experience as well. I've seen patients really have an increase in their quality of life, especially when they're going through treatment and they do something like a ketogenic diet. And then again, ketosis is that metabolic state where your blood ketones are high and your blood glucose is very low. And so that your body is able to utilize the fats as a fuel source versus more of a primary glucose metabolism. No major adverse events have been reported within humans, and most case reports show an excellent therapeutic response to the ketogenic diet within their tumor itself. So this is a study that my group did. We started this study back in 2016. It ended in 2018. We had about 12 patients, that ended up finishing the diet. And we had a very interesting cohort, so to speak. This was a very grassroots project. We got an external funding and basically, asked our patients within clinic if they were interested in doing this diet. The outside funding also gave us and provided ketogenic meals and snacks, as well as glucometers and ketone meters. So for 8 patients, we have a very good overview of what exactly they ate, because I was monitoring everything that they were eating, and they were only allowed to order off of a keto menu, so to speak. And then we correlated their intake with their ketone values to make sure that they were actually adherent to the diet. And so that if they didn't have the presence of ketones, we kind of knew something was going on, right? And then we also had another cohort of 4 people who just received meal plans and training and reinforcement, I should say, for myself. This table shows the types of cancers that were available within these patients and who finished the trial. And so just what I want to highlight is this table. Most patients were going through cancer-directed treatment. So they were doing the initial cycle of their Temodar and radiation. And something I really just wanted to note was there were a lot of improvements or even stabilizations within especially mood, physical strength, and then energy and fatigue, which we typically actually see declines throughout treatment. And so if we can stabilize or even improve these quality of life measures, I think that's really something to know and recognize. Next slide, please.
Well, thanks so much, LJ. I'll take over. I will try and take over for the next 2 slides. And LJ set up the discussion of ketogenic diets extremely well. And there's been a lot of interest in this as a dietary treatment for glioma. And this is a question we wanted to ask a few years ago. And there are unresolved questions. What's the dose? What's the frequency? When should this be inserted in brain tumor care? And so a few of those questions we asked in this study. And this was the glioma Atkins-based study, which is the GLAD study. You got to love that name. And I'll walk you through a few things that we found in this dietary study. The first is in the center of the picture on the right. We're looking at a very specific dietary intervention called the GLAD diet. The GLAD diet is a combination of the modified Atkins diet, which is a more modest ketogenic diet where there's glucose restriction, carb restriction, but really not a significant amount reduction in the total amount that patients eat, less protein and restriction than other ketogenic diets. And that was combined with intermittent fasting. And intermittent fasting was a day of substantially reduced calorie intake. So this was not an easy diet for patients to do or not for the faint of heart. And we were looking at two things. One is, can this really change the metabolism that's occurring within the body? Can patients get into ketosis and remain there for 8 weeks? And then two, and really importantly, and what you see in this image to the right, is does it change the brain? And patients had this special type of MRI scan at the beginning and end of the study, at the baseline in week 8, and we were looking to see whether the diet could actually change the brain and the brain tumor. And there are a few things that we took away from this study. The first is the table to the left. We screened 116 patients for the study, and we're only able to enroll 25. This type of highly restrictive diet, which is a substantial change, is not for the faint of heart and not for every patient. And for many patients, those patients that enrolled in the study, this is something they were interested in doing, that their provider, their doctor was interested in doing, and they were able to do quite successfully. But it's not for every patient. And so this is something to think about with you, both yourself and your family and your neuro-oncologist as well. Next slide. The two findings in this study, which are highlighted here on the top, the first thing we found is that this diet changes the way the body works. And so what you're looking at here is the degree of ketosis. And the white color is no ketosis. So you can see at week 0, patients were not in ketosis. Their body was in a normal state of metabolism. And over the course of the study, very quickly, most of these patients were able to achieve ketosis with this diet. And that is one of the ways that we follow and monitor patients who are on a ketogenic diet. What we were very interested in is shown in the graph on the bottom, whether we were able to flip that same switch in the brain, and could we change the way the brain was working and the way the brain tumor was working as a result of this diet. And Ambreen will click through, and what we can see with this first circle is ketone bodies in the brain. And so here we're looking at that same purple that we see at the top, but we're looking at it in the brain. And the green is more ketones in the brain. And we can see that when patients were started on this diet, their brain metabolism changed. And what their brain was using for fuel, for energy, changed from the normal fuel to ketones. The right circle shows both the normal brain and the tumor. And what we're looking at is sugar levels in the tumor, what the tumor is using for fuel. And we saw substantial changes in how the tumor was able to use sugar and normal metabolites. And so this was highly suggestive that these ketone diets and ketogenic diets can change the way the brain works. What we don't know is whether that improves the lives of brain tumor patients, and does it expand survival? Do patients survive longer? Interestingly, in this study, we saw the same thing that LJ just introduced, and that is that patients who went on this diet really reported improved cognition and less fatigue and felt better on the diet. And ultimately, those are key indicators that we look for when we're taking care of brain tumor patients about whether a treatment is working and doing what we want it to do. Next slide.
Thank you so much for presenting your study. I really appreciate your expertise. Just to quickly talk about exercise, because we really want to drive home that we want to take care of both of our, our physical and our mental. And so Exercise can be really effective for a number of different outcomes within cancer. And so if we look at this table, we have very strong evidence to support that exercise can help reduce cancer-related fatigue, which is super tricky to treat. I know a lot of times I hear patients tell me naps don't really help. And so then when we talk about exercise, they actually get that wind of energy that they're looking for that the nap won't provide. But granted, naps also do help with rest and listen to your body as much as possible. It does help with quality of life, just like we've talked about in terms of keto, but exercise also helps with your enhancing your quality of life, your physical function, anxiety, and depression. And then there's moderate evidence to support that it can really help with your bone health, especially with resistance-based exercises or things with weights or resistance bands. And then also it's been shown to help with sleep. And so there is a difference in terms of aerobic versus resistance. And then also there's a combination too. And so this table shows different doses if you're doing aerobic versus resistance versus both. And then there are specific doses for each activity. And so you can see most of the aerobic exercise is looking at 30 to 60-minute sessions at least 3 times per week. And then resistance exercise, we recommend at least 2 to 3 times per week, if at all possible. I also just want to note that if you have any instability or if you're not stable on your feet, you need a walking buddy, definitely talk to your provider before you start doing any sort of exercise. Next slide, please. So then what does different types of aerobic exercise look like when we're talking about light versus moderate versus vigorous exercise? And so really these are different examples of exercises per the types of effort that you're exerting. But something that I like to highlight at the bottom is a kind of easy takeaway. So if you're doing light exercise, there's really no noticeable change in your breathing. We're not elevating your heart rate to the point where you're huffing and puffing, right? Then we have moderate exercise where if you're taking, let's say you're doing an uphill walk, you can have a conversation with someone, but you wouldn't be able to sing a song because you're breathing a little bit too labored, which is a good thing, of course. And then vigorous exercise is something where you're really not talking, you're not having a conversation, you're not singing, you're really focused. And so the exercises are listed here. And something I highlight is that yoga can actually be something that's across all spectrums and also really a beneficial exercise that connects your mind and body, so you have double the benefit. Next slide, please. And then just lastly, from my end, if you want to think about what can I do today to help myself, this is a checklist from the American Institute for Cancer Research. And these are all different types of suggestions if you are looking to make small little changes throughout your day or week. So this is available online too, or on these slides. Thank you.
So in the last couple of minutes, let's put it all together. And let's sort of come back to some of our initial questions and summarize what we've heard. One of our first questions was, are diet, exercise, and lifestyle anti-tumor treatments? Can we use these to effectively treat brain tumors? And I think this is a place where we really need more data. We're very interested, very excited, particularly about ketogenic diets and other dietary therapies to treat the tumor. But we're not quite at the place of having all the data. But that's not the whole story. Exercise is critically important in brain health. And what you're looking at here is a number of other diseases where exercise is known to improve how patients do. So in Parkinson's disease, exercise is an approved treatment. It helps Parkinson's patients do better. In Alzheimer's disease, a number of studies have looked at exercise and the benefit in preventing cognitive decline in patients with Alzheimer's disease. So we're not yet at a place where we have data to say we can use diets to treat brain tumors, but exercise is a critically important treatment that we have for patients to improve brain health for many conditions and likely from brain tumors. Next slide. One of the second questions we've talked about is, can diet, exercise, and lifestyle minimize side effects and improve treatment delivery? And this is really important. If we can deliver our treatments more effectively, minimize those side effects, our patients will do better. And here, I think it's all about that balance. What's the risk of this intervention and what's the benefit? And what we're looking for in the clinic is things where the risk is low and the benefit may be moderate to high. Interventions where there's higher risk and the benefit is unclear, those are things we don't get excited about. But when the risk of a dietary intervention, a change in dietary treatment, a supplement, exercise, lifestyle changes, or others, the risk is low and that benefit is moderate to high, those are things that we sign up for and would be very interested to talk more with patients about. Next slide. And the last question is, do diet, exercise, and lifestyle influence quality of life or life quality? And here I think there's a resounding yes. And I want to briefly walk through just a couple of the images that you see in front of you. There's been a lot of work over many years to look at the impact of happiness and how happy we are and what it does to our bodies. LJ mentioned that eating is a social event and exercise is often a very social event, and they're very important in our overall well-being and quality of life. It turns out that happiness, those endorphins, that dopamine that is released when you're eating with others or sharing with others or exercising and improving your overall health, changes how the body works. In the image on the left, we're looking at a pathway that's called the CTRA pathway. It's important in inflammation and ability to fight viral infections. And it turns out that patients who are more happy and who have greater well-being have changes in this pathway and the way that it works. So in the last slide, I think the take-home here is happiness is a state of active and activity. Diet, exercise, and lifestyle are really critical in that well-being, our overall happiness. And whether we're using it or thinking about using it to treat the tumor or minimize side effects or improve quality of life, it is certainly an important part of the overall treatment for a brain tumor patient. So with that, I think we have time for a couple of questions. And LJ, I have the first question for you. It was fascinating to hear what you've discussed. One of the questions I get a lot from my patients is, can I do anything with my diet to improve my blood counts? Because my blood counts are low after treatment. What do you think about that?
Yeah, it's a great question. It's something I get as well. There is a degree where we can't really necessarily improve our blood counts per se when we're going through treatment, because that's the way it works, right? We want it to affect the bone marrow, which is where these blood cells originate. However, there are a few things that we can keep in our back pocket to maybe help our counts. So especially for things like your red blood cells, which carry the hemoglobin and our oxygen around our body, if you can maybe, and if it's okay with your diet and your values, prioritize animal-based proteins. So things like fish, chicken, turkey. Even if you wanted to do a little bit of red meat, American Institute of Cancer Research says that up to 18 ounces of red meat per week is fine in terms of your cancer and cancer risk. So that's something to consider. If you are having an animal-based protein, pairing it with a dietary source of vitamin C helps to increase the efficiency of absorption. Cooking with a cast iron skillet could be something to consider as well, because that can enhance the absorption of iron. And then for blood counts, in terms of white blood cell counts, things that I really prioritize for that is making sure that patients are getting enough calories coming from protein, that they are prioritizing rest. And then I know it kind of sounds a little bit funky because we're talking about cancer, and it's of course normal and valid to feel stressed and anxious as you're going through cancer-directed treatment. And stress and anxiety does have an effect on our immunity. And so really trying to manage that as much as possible. So Dr. Strowd, for you, I thought I wasn't allowed to exercise on treatment while I'm on treatment. Is that true? I get that all the time from patients. And so what's your opinion?
This is a great question. And exercise, in my opinion, is critically important for our patients. It has to be done safely, and particularly for patients with a brain tumor where they may be at risk to fall. A fall can be catastrophic. But activity is great. It improves function of the brain. It helps patients sleep better, and sleep is critically important in overall health. I really like my patients to be as active as possible. Sometimes that's with a physical or occupational therapist, but a lot of times that's just getting up and walking to the mailbox once a day, or getting outside and walking around the house, at least once or twice. That's important in terms of the physical movement of the body, getting the heart rate up, getting the brain working, but also just emotional well-being. It's great to get outside, and that really is an important part of overall health. So I really encourage patients to be as active safely as they can. Next slide, LJ, I got one more question for you. Since you eat a smaller amount of food on the ketogenic diet, there's just less food you're eating. Aren't you hungry or starving? Is that a problem that you see for patients on these diets?
Sure. I mean, certainly, I think if people are kind of doing this on their own and they're trying to do keto without having it be planned or have a professional on their side. However, fat does provide more calories per gram versus carbs and protein. So fat is going to provide 9 calories per gram of food, whereas carbs and protein provide 4 calories per gram. So you're still getting a substantial amount of energy. I would say though, most people actually feel less hungry when they're on the ketogenic diet, and we see weight loss especially too. And so I don't think, I definitely don't want anyone to be starving. We obviously really care about nourishing ourselves and our bodies because it's super important. So most people that I see are not hungry or starving, but if that is an issue, it's more of an issue of food choice, and they're having issues with finding the right and appropriate foods.
Really helpful. Thanks, LJ.
Of course. And then I have another question for you as well. There is a lot of talk about intermittent fasting. I hear this all the time. What is that and how does it work?
Yeah, this is a great question, and this continues to be something that is defined. If you talk to 10 different people, they'll give you 12 different definitions of what intermittent fasting is. So I would really encourage patients who are thinking about this to speak to their dietitian and their cancer team. This is a situation where patients can get into an unsafe area with diet, but this can be a very helpful part of flipping that metabolic switch into ketosis. In our study, intermittent fasting was reducing the amount that patients ate by 80%. So a really substantial reduction over the course of the better part of a day. But some people will do intermittent fasting just overnight, skipping breakfast or delaying breakfast. So there's a lot of different ways to do this. This may be an important metabolic switch in the body and in the brain, but this is something where I would really encourage patients, if you're interested in something like this or you've read something about it, to talk with your brain tumor team, that dietitian, neuro-oncologist, and understand how to incorporate that into your dietary treatment. And then the last question, maybe just in a minute, LJ, is if you could choose one tool that you feel could really help patients leverage at their own disposal, how to think about this, how to address diet or talk with their providers in 1 minute or 30 seconds, what would you say, LJ? What's that tool?
Yeah, I think, it's an amazing question. However, I think especially from what we both spoke about today, real health and wellness comes from multiple different pillars. And so if we really want to leverage our health and wellness, we need to focus on all of those different pillars. If I were to boil it down to one thing that patients can do, I would really emphasize hydration because it's so important. It helps with that cancer-related fatigue. It helps to flush your kidneys out. It just helps with your overall function and well-being. And so if there was one tool that I would choose, I suppose it would be hydration, but really to focus on all of the pillars that we talked about today, if possible. Thank you.
Thank you so much for that wonderful presentation. We do have time for questions from the audience. As a reminder, if you have questions that you'd like to ask, please type and submit it using the Q&A button at the bottom of your screen, and we'll answer questions as time allows. So one of the first questions we have here, LJ, I'm going to direct it to you, is asking about ketones. So you talked about ketone level. Is there a certain ketone level that is considered safe? And is there a level that may be considered too high or too low that can cause risk to the patient?
That's a great question. So in general, we don't necessarily have a therapeutic dose per se in terms of where your BHB or beta hydroxybutyrate levels should be at. That's the most abundant ketone that's found in the blood. And so from our perspective in our clinic, we typically try to have patients be between a 1 and 3 millimole per liter, and that's through the blood. We don't use urine strips. People can definitely use urine strips, though. I think it's really effective in terms of seeing if you're in ketosis or not. They do become a little bit more inefficient over time, though. In terms of an unsafe level, the unsafe level that we've seen in research is upwards of 8 millimole per liter. However, I've never seen that in practice, even with patients using ketone supplements. So I think it's really hard to get to that maximum dose or level within the blood. And then in terms of the lower level, most of us aren't normally in ketosis. So if you're at a 0, it's not going to harm you at all. It's just that you're not in that metabolic state where you're burning fat as fuel.
Thank you so much for clarifying that. Dr. Strowd, I'm going to address this next question to you. Each of you kind of talked about how diets like keto, the keto diet or the GLAD diet, Dr. Strowd, that you talked about, are not for everyone. Can you share with our attendees what are some factors that they should consider, questions they should ask themselves when they're determining whether or not a dietary change like this is appropriate for them?
Yeah, this is a really good question. And I might actually start with, talking with your family members first about just what interests them. We found in our study that patients whose family members were also interested in pursuing a dietary change were much more likely to be successful in implementing and remaining on that dietary intervention. So diet's a social event. What we eat, we often do with people. And so first thinking about how this can be incorporated in all the rest of your life is very important. When talking with your doctor, I think it's important to think about where you are in cancer treatment. There's a lot of things that happen when a brain tumor patient is first diagnosed with a brain tumor, and changing their diet may not be the best thing to think about at that early time, right at the initial diagnosis. During radiation therapy, we really just don't understand how feasible the diet is. There's been some studies done in that area, and that can be a difficult time to incorporate a diet. After radiation treatment, during chemotherapy or after chemotherapy, as we did, are times when I think patients can consider bringing that to their providers and understanding whether that's a time in treatment that's right for them. Their providers will think about other medical conditions they have that may make a dietary intervention not a good idea. Cardiac risk and other sorts of things we would consider carefully in patients doing a ketogenic diet. And bringing in a dietitian is a great idea. We work very closely with our LJ down here at Wake Forest. And so meeting with a dietitian early during treatment can be helpful for exploring these things for patients.
Thank you so much for that insight. LJ, this question is for you. Is there an optimal amount of time that a patient should be on the ketogenic diet? Should it just be while they're in active treatment? What are your insights on that?
It's a great question, and it's definitely something that we still need to solve. I would say, Dr. Strowd, you really hit the nail on the head. I think that if you have the social support, the more social support that you have surrounding this, the better. And so really think about, the evidence that we have so far is that it does help in terms of decreasing the side effects that you experience during your cancer-related treatment. And so with a lot of my patients, they typically do keto strictly throughout the 6 weeks of their treatment. Some people decide to cycle and do a ketogenic diet every 5 days when they're doing their cycles throughout the rest of the year. Some people maintain it because they have seizures and it really helps with their seizure control. Some people continue it because it gives them a sense of control. Again, I would ask is if it's enhancing or decreasing your quality of life at all. And that would be my measure, because there really isn't a gold standard of you should be on this indefinitely. You should only be on this during your treatment. So really what's going to work for you and how does it make you feel is the most important questions to ask.
Thank you so much. This next question, I'm going to direct to you, Dr. Strowd, but LJ, if you have any additional insight, please feel free to jump in. So the research that both of you talked about during today's presentation was focused on primary brain tumors and gliomas. Dr. Strowd, are you aware of any research that has been done regarding the keto diet or maybe the GLAD diet that is focused on secondary or metastatic brain tumors?
Yeah, this is a great question as well, and why we started our discussion thinking about the brain metastasis. There has been a lot less research looking at ketogenic diets for brain metastasis. In fact, in those patients, the studies have really looked at treating the primary cancer, the lung cancer, the kidney cancer, the colon cancer, and ketogenic diets have been much more difficult for those patients and probably less effective. We don't know what they do for the brain metastasis. So I think thinking about that today is a little premature. I don't think we have the data to know what happens with a ketogenic diet for a brain metastasis, but this is something that would be a good question to ask for this patient with their primary treating team. Certainly a good question to bring back to the team.
And the one thing that I would add, I mean, that's completely accurate. With lung cancer, though, it is a very catabolic disease, meaning you can blow through your calories really fast. And so because this diet does promote weight loss, I would take that into consideration. If you are already underweight and you've lost a lot of weight, that's something that I would really recommend thinking about maybe not doing right now, or maybe doing a modified approach, because we really do want to maintain your muscle mass and your lean body mass and making sure you are nourished.
Thank you so much. I'm going to take just one last question. LJ, I'm going to direct this one to you. Some patients, they may experience loss of appetite, either due to their tumor or the treatments that they're going through. Do you have any advice on how they can incorporate some of the dietary recommendations that you've made when they just don't feel like eating?
Yeah, and this is super hard because it's really hard for everyone who's involved, right? For the patient, for your loved ones, because like we've talked about, love is a social thing. It's also how we show our endearment, right? So it's really hard on both parties. And so I just want to say that it's also really hard to make yourself eat. And also when you're going through cancer-directed treatment, I'll be honest, sometimes your appetite just isn't there. And so you can't rely on your body cues because it's a little bit off. And so if you find yourself going more than 4 hours without eating because you don't have a hunger cue, I would maybe start to set some alarms. I would really focus on foods that are super easy to eat and don't require a lot of effort. So I go for more of like the snack-like foods like nuts and seeds, olives, avocados, soups, smoothies, things that require very little preparation and very little effort to consume, and trying to do that a little bit more frequently throughout the day so that you can maintain your weight.
Thank you so much for that advice. I think it's something that a lot of our attendees can benefit from. Unfortunately, that is all the time that we have for questions for today. Thank you again, Dr. Strowd and LJ, for joining us and for taking the time to share your insight and expertise. And a special thank you to each and every one of you for joining us live and answering and sharing your questions. We hope that you found this webinar to be informative and beneficial. We encourage you to take a few minutes to complete our webinar survey by scanning the QR code on your smartphone or going to the link on the screen here. Your feedback is important to us as we plan for future programs. You will also receive a link to complete the survey and a follow-up email message in the next few days, along with a link to watch the recording of this program. If you are looking for more content like this, please check out some of our free upcoming events, such as our patient and family meeting on adult low-grade gliomas taking place next Saturday, March 4th. For more information about ABTA's programs, events, and services, visit ABTA's website at abta.org, email us at info@abta.org, or call the ABTA Care Line at 1-800-886-2282. This now concludes our webinar. Thank you so much for joining us and enjoy the rest of your day. You may now disconnect.